Former New York Governor Andrew Cuomo is set to testify next week before the House Oversight Committee on the COVID pandemic. The hearing is expected to focus on the guidance Cuomo issued in the early days of the pandemic that led to New York nursing homes admitting patients who had COVID-19. The committee chair, Republican Brad Wenstrup, said in a statement, quote, Andrew Cuomo owes answers to the 15,000 families who lost loved ones in New York's nursing homes during the COVID-19 pandemic. On September 10th, Americans will have the opportunity to hear directly from the former governor about New York's potentially fatal nursing home policies. Cuomo spokesperson said, quote, this committee has continued to engage in false political attacks blaming New York for nursing home deaths, despite the fact that New York was following guidance from former President Trump's CDC and CMS. More than a dozen other states, Democratic and Republican, followed the same guidance, or as one of those states' leaders, Minnesota Governor Tim Walz, put it, this was federal guidance. This was what everyone was doing.
The hearing is another part of Cuomo's continued fall from grace. You'll remember Cuomo was treated as a star and a hero during the beginning of the pandemic. Here he is with his brother Chris Cuomo on CNN back in May of 2020.
This was the actual swab that was being used to fit up that double-barrel shotgun that you have mounted on the front of your pretty face.
Another time, Chris Cuomo asked his brother whether he was considering running for president, given his popularity. Andrew Cuomo would then go on to write a book about his COVID heroism. But following sexual harassment allegations from 11 women, this is what happened in August of 2021.
I think that given the circumstances, the best way I can help now is if I step aside and let government get back to governing.
Now, this was a huge scandal. I remember being in the tri-state area. I had friends whose grandparents were in nursing homes. New York's a very densely populated city. Of course, it's an impossible thing to make policy during a pandemic, but you've got to if you're the governor of a state. And it's true that the federal guidelines did suggest that if a patient had been determined to be healed at the hospital and it was not necessary for them to be there, they could go home, including if their home is a nursing home. And so following that guidance in a state like New York is difficult because the nursing homes are much more densely populated there than, say, a nursing home in the Midwest. And so it's a difficult decision, but he didn't have to lie about how many deaths there were and try and cover that up. That was the part of this that I think just really made it a failure on the governor's behalf.
Right. Yeah, let's be very clear here. So first of all, the discharging the patients, the issue is that this was people who had COVID, who were infectious, who are now stable and didn't necessarily need to be in the hospital anymore. And the policy was to return them to the nursing homes to make room at the hospital for more seriously sick people. The problem with doing that is older people are by far the most at risk for a negative COVID health outcome. So even if you have someone who's stable, you return them to nursing home, that was spreading the disease in the nursing homes, and that was a terrible idea. Now, you're right that was actually federal suggestion, and then the New York State Department, the New York Health Department of that state decreed to do that, and many other states did as well because that was guidance from the federal government. But Cuomo, as you note, also then covered up the deaths resulting from that, pretended the problem didn't exist, wrote a book lionizing his handling of the COVID-19 pandemic, minimizing the number of deaths that occurred because of that. And that is an additional level of unconscionable behavior. I would also, it's funny, he references Tim Walz there, who I've criticized previously on the show in a radar I did on his COVID policies, which I think were absolutely disastrous. And he actually defended the policy of readmitting, of turning COVID patients back into nursing homes, even after it was clear that was a catastrophically bad idea that did result in a lot of people getting sick and dying. So in some ways, that's worse because you shouldn't. It's one thing to say, well, it was a mistake and we didn't know better and everyone did it. It's another thing to say that I would still defend it given what we know now. But anyway, yes, Cuomo deserves, the American people deserve answers from Cuomo on his cover-up. I would remind everyone that he didn't actually end up resigning because of the COVID stuff, which was by far worse. He ended up, resigning over sexual misconduct accusations from numerous women, which, not to say that those are not serious or trivialize them in any matter, but having presided over a policy that resulted in up to whatever that figure was, 15,000 deaths, and then covered it up, that's worse. That's way worse. And it's like they didn't want to reckon with his complicity in that, and so they ousted him on this much more pretextual harassment charges.
Right. I'm curious if Ron DeSantis is going to end up testifying before this committee as well. He is another governor during COVID. I was in Florida during COVID, and he tried to lock the state down. He did an all right job. I had to have my temperature taken, write down all of my information and my address as I crossed into the Florida border. I went there and stayed with a friend for a month right after the Bernie campaign ended. And he was taking the pandemic very, very seriously there in Florida. That didn't stop Florida from becoming one of the states that was experiencing a very high number of cases and a high number of COVID deaths. And he is another governor, like Andrew Cuomo, that was found to be hiding the number of deaths. The state auditor of Florida did a thorough investigation into the numbers released versus the real numbers. There were times when DeSantis was posting on Twitter saying we had no deaths today. That was not true. They had many more than 0 deaths in that day, as was pointed out by this investigation. And so I would like to see them call Ron DeSantis to testify as well. Andrew Cuomo took a lot of heat for, covering up these deaths, but like the governor of Florida, like the governor of Minnesota, a lot of these people were simply following the guidelines of the federal government and the CDC under the Trump administration. But there were 2 governors, I have to point out, that did lie about the COVID numbers. And I think Andrew Cuomo ended up resigning because while he could say we're following the federal guidelines, I didn't know about the reporting. I didn't know the numbers were false. There's a whole line of people assessing the numbers and the information didn't get to me properly or get filled out properly. Things were crazy. It was a pandemic. We were trying to figure everything out. He could have gotten away with it. But I think it really added to the fire that you had these women come forward while Andrew Cuomo was already swirled in controversy. So I think that's really what did it. But I would just like to see them interview Ron DeSantis, ask him about what happened during COVID there in Florida.
I'm not familiar with what you're referencing. The miscounting of deaths in Florida is because he said at one point that we're counting. I actually think this was true. That it's probably been true everywhere that they were counting some people who had died who had COVID when they died, but is not actually caused by COVID. They just happen to have COVID. Is that what you're referencing?
That was a part of it, of him directly, misrepresenting the numbers through his, communication channels. But it was also the case that the data reported at the state level in Florida did not match the actual numbers. If you go through and look at the data reported actually by the hospitals and through the proper reporting channels in Florida, that the numbers that were being put out and reported under Ron DeSantis's administration were false.
Yeah. I mean, if you look at the numbers, there were not widespread, there were not significant differences in deaths relative to the population and the health of the population. Florida has a lot of older people living there, people who retired moved to Florida, but that red states and blue states in general did not have very different death rates for the first half of the pandemic until the vaccine rollout, and then there was some differences because there was more vaccine hesitancy where it would have helped older Americans in some states. But the point being, for the first half, the mitigation efforts, even the stricter ones followed in blue states versus the laxer ones in red states, because while red states did lock down, they were quicker to reopen and let people go to parks and beaches and things of that nature. That did not translate to a big difference in deaths. It was not, the difference did not emerge until there was a slower vaccine uptake among vulnerable Americans in some red states, although Ron DeSantis, of course, was very enthusiastic about providing vaccines to everyone who wants one, not requiring it of anyone. It shouldn't be required, but of partnering with providers in the state of Florida to do that rollout, and which was very, very praised, and he was very enthusiastic about that. So I think that was a good thing.
Yeah, I can point to the exact numbers. So the auditor of Florida found that the deaths were undercounted by at least 3,000. Ron DeSantis, time and again, said he didn't agree with the way that they were collecting the data and they were overcounting the number of deaths when actually his Department of Health was putting out numbers that were not accurate. So they went in and revised this. It's true that it's difficult to make policy during a pandemic, but there's no reason to be dishonest or to lie about the numbers in your state as governor. But I think because of these political attacks, that's why they do it, right? Because Andrew Cuomo is going to be attacked for what? Following the CDC guidelines. And so he's incentivized then to lie about the numbers. I think we need to recognize that, everyone was doing their best during the time of COVID. And I hope something good will come out of this committee more than just politics as usual and finger pointing at someone on the other team when you've got guys on your team that did similar things.
Yeah, but nobody else. I mean, Cuomo wrote a book bragging about how good his pandemic response was, and then, directed his staff to minimize the number of nursing home deaths because he knew it made him look bad, which is because he wanted to sell more books. It was a pretty bad thing to do, and so we'll see him answer questions about that at this committee hearing. More Rising right after this.